Good day, namaste. My name is Surya Soni. I welcome you all into this first pre-recorded webinar. We This is the first such pre-recorded session we are doing, and our first guest speaker on such format is Dr. Pranjal. Welcome, Dr. Pranjal Pandey from New Delhi. You are a neurosurgeon, and you have kindly shown your interest to present your experience into neurosurgery and talk about psychology side of things, that what are important issues and what are important knowledge and wisdom you may want to share with the wider diaspora in Victoria in Australia, as well as in wider uh, India and humanity for in general. So thank you so much, Dr. Pranjal, for joining this webinar, and over to you. I request you to briefly introduce yourself and share your presentation from there.
Thank you, Surya Bhira. Thank you for giving me an opportunity to be a part of this Munch Vichar. And I'm really honored to be a part of this. And I have attended a couple of sessions before, and I really think they do add a lot of value to people in general because the variety of speakers that we have had in the past and the diverse topics that have been shared, they are they are not only important from a professional point of view, but actually they do tend to elevate the level of understanding of common people in general. So I do believe that I do have certain insights. Being a doctor, I have insights of what I find that the patients should know, and when I find the patients are really distressed. It generally pertains to neurosurgery. However, my talk is not going to be limited to neurosurgery. I will be speaking more as a doctor. And before I proceed with the presentation, I'd like to introduce myself. I am Dr. Pranjal Pandey. I am a neurosurgeon by profession, and I practice as head of department neurosurgery at Primus Super Speciality Hospital at Delhi. So, during the course of my training and during the course of the profession that I have had till now, I have realized that there is one part of the profession that deals with the analytical and professional aspect of things, like how to be a good doctor, how to be a great neurosurgeon. You do a diagnosis, you do everything good, you operate well, right? But what I also have realized in my experience that a good outcome for any patient, which is ultimately the goal, is not just dependent on how beautifully or how well I execute my profession. There are immense gaps which are there between a proper execution and culmination to an optimal result. And those gaps are generally because of lack of miscommunication. Many a times, this lack of communication does not translate into a very good outcome. And when I see this, when I make this presentation, it will be my endeavor to at least provide a bird's eye view to all the listeners of Vichar community and all the people to whom this video may reach, that what we can do to just improve our understanding of the medical conditions that we have on a very general and a very common level, because something that is spoken as A may always not mean A until unless you understand the required the context, right? And especially in today's age where information is so much democratized that social media will hand over all the available information at the click of a button. So how do we really differentiate that what we are reading online, whether it applies to us or not, how beneficial it is? And the real trouble starts when the information that is there at our fingertips, it's somehow at odds with what the professional is telling you. And I really find that these are some of the gaps that have the potential to create a very big divide, both amongst the doctor community as well as the patients, to really understand what the issue is. And so, as I move forward with the presentation, I would like to stress upon a few points by giving some examples. And I really hope that by the time I end, I will be able to inculcate some sense of clarity into this complex field of medical diagnosis, because I do believe that probably almost every one of us, our families, will have one person who may be undergoing a treatment as an outpatient or an inpatient. And so therefore this information becomes important to all of us because healthcare is very deeply integrated into our lives. And so with this, I seek your permission, Surya Bhaiya, if I can share my screen and
Yes,
start with the
please.
presentation.
Thank you so much.
Right. So with everyone's permission, I would like to begin with titling the topic as a medical decision making in the digital era. And again, the core idea that I want to discuss is how does one navigate the medical advice in digital age. When I'm speaking about this, believe me, my intention is to take the point of view of the patient's perspective more than the doctor's point of view. And while I will intermingle between the two, but I would try to instill some sense of clarity in what I am talking about. So we have to understand that whenever we go to a doctor is as a human being as you are. And so therefore, a doctor will always have a very acute sense of his own knowledge as well as his experience. And remember, experience is very important. Knowledge is always based on facts. Experience always takes into account that gut feeling that we usually talk about. All right. So we have to understand that when a patient is being clinically evaluated, even if the doctor is maybe just sitting at his chair, fiddling with his pen, and is only nodding to the questions that he's asking you, believe me, his mind is working at a very rapid pace. The only difference is that the doctor's experience has made him into a person and has made him reach a stage where he processes information very, very fast. So unlike what we may feel, what the doctor is doing, his analysis actually is far ahead of what appears in front of you. So what happens is that a doctor, as a part of clinical evaluation, he may take your history, ask a lot of questions, and believe me, 70 to 80% of the diagnosis of your problem that you're saying is made on the history itself. This is also coupled with clinical examination, and generally evidence is also taken in the form of some investigations. So by a combination of all the three, this is how basically any doctor tries to reach a diagnosis. Now, what happens when you look at the same information on a digital platform? So, the basic principle of a digital platform is while it is very nice to hear that somehow the word platform is so neutral, it's so agnostic. But in reality, the underlying idea behind a platform is that it is trained to increase engagement. It is trained to increase the virality of any content that is being produced. And obviously, as the AI apps and the social media apps get bigger and bigger because they tend to learn from our behaviors and our internet habits, they also tend to have a lot of level of personalization. As an example, what you can do, just search for a word, say maybe sciatica on internet. Okay. And if you have not installed any ad blockers or something, believe me, the next time when you go back to a Facebook or a browser, you will get personalized ads about sciatica or about medicines of sciatica or about tests of sciatica or even about clinics who may be offering services for the treatment of sciatica. So that is how an AI driven or algorithmic driven digital content platform works. It will trace you and it will give you views based on the engagement and the virality of it. Right? So this matters in clinical practice because it is a very, very natural tendency. So if I have an issue, and you forget even the medical field, let's suppose if I were to think whether 24 karat gold is good or 22 karat gold is good for investment, maybe I'm not going to ask an economic person, investment banker for this. Probably what I'll do is first I'll go to Google. So now Google has become a first teacher. I'm not saying it's always wrong. I'm only trying to put a context to it. So what happens is when a patient or for that matter, any person who's suffering from any issue, let's say a headache. Now, when we type this headache into a digital search query, we obviously see certain results. We go through it, we see the good of it, we see the bad of it. Our mind is already made up once we have read a few data or data pages, right? So what happens is you have to understand if I type headache, what will be the first page that comes? Usually the top three listings in Google listing. I mean, I'm sure usually that is the case. The top three are very small written sponsored. The sponsored ones are obviously sponsored with ads. So those will be the top three. Now, amongst the organic, even the one who is on the top, I'm not here to criticize any page and its information. I am only trying to say that even Google searches and uses certain level of parameters on which it takes a page to number one. And those parameters does not always mean the accuracy of the data. There are other parameters also which makes the ranking of a page go up higher rather than the accuracy of a clinical diagnosis or the accuracy of the data. And because once we have a certain level of misinformation in our minds of whatever we have read, believe me, then we enter into a kind of intellectual scotoma, meaning because we have read something, many a times common sense will prevail. Common sense will tend to, take a backseat over whatever we have read. And when we approach a doctor with this mindset, even a good advice of doctor is usually taken out of context. How? I'll explain to you later. So see, now let me again, define this. The word context is something that I'm going to use a lot many times maybe in this presentation, and hopefully if I'm able to be a regular part of Vichar Munch, even later, the context is the most important thing. And so now when we're talking about the medical field, let us see this. We wouldn't take a random pill we found on the floor just because it has cured maybe Chunnu ki dadi's headache, right? We have to understand what is the reason of headache, whether we should give only symptomatic treatment of headache, what medicine should we give, what is the mechanism of action, and what is actually the history of the patient. Without knowing this, popping up any random pill is more likely to harm you than benefit you. So we have to understand that when we open up Instagram and we see random exercises, lose your belly fat within 10 days, or maybe don't take any medications, but top five mistakes you are doing while doing a squat. So it is very engaging because the headline, the thumbnail, it has been created in such a way so that it can grab all the eyeballs. But what it doesn't understand is the clinical context. So if I'm an obese person, whether this exercise will suit me or not, if I'm having a cardiovascular risk, whether this exercise is really going to benefit me or not. So again, the same underlying concept comes. What is the trap? The trap is algorithm will show you what is more popular, what is more viral, what is more trendy. It will not show you necessarily what is safe or what is more clinically relevant to that particular patient or subject. So, what is the clinical impact of algorithm to prevent health advice? So first, as I said, the patient behavior is altered. Why? Because patient generally comes predetermined with a pre-selected diagnosis. And when you say anything which does not match the patient's pre-intended diagnosis, that is where the patient starts discussing the doctor. I'm not saying it happens in all the cases, but I'm telling you it happens usually because the very first question that the patient says, doctor, but I saw somewhere, don't these symptoms mean this? So kind of a negative trust platform is created between the doctor and the patient, not because the patient inherently wants it, and not even because the doctor is not giving the right diagnosis. Only and only because our minds are pre-filled with whatever we have read out of context. So increased reliance of search on social media algorithms, it basically reduces your openness and willingness to listen to an initial clinical assessment. For the quality of the information, the health content, it is not optimized for the accuracy or the relevant clinical context. It is optimized for engagement. It is more optimized for either it will make something so simple as if losing weight is such an easy thing, but we have to understand, common sense has to prevail. If it were that easy a thing, wouldn't all people lose weight? I mean, why would they run with all the operations and God knows what all pills? Believe me, I'm not trying to say that operations or surgical interventions or pills are the answer. What I am trying to tell is that when you look at information out of context, it either very much simplifies it or it takes to a level of extreme anxiety. Are you making these kind of mistakes for your heart? Immediately somebody seeing this video will be very anxious that whether I'm making this mistake or not. So they will probably watch the video. And not necessarily accurate information is given in the video because the context is always missing. So generally, personalization is missing when you look for any information on social media. Age. What are the existing comorbidities? Is there any history of prior injury, disease, or any operation? So when you write something on a social media, or for that matter, even put in a video or a picture, generally we fail to provide a very, very contextualized or highly specialized information tailored for that specific patient. So general information generally is trying to, overload your mind as a very specialized information. And what happens as far as the clinical outcome is, there is again a very, very increasing, the incidence of increased mistrust between the patient and the doctor. We'll find that this is actually in general, doctors are a very respected community, but the level of mistrust is increasing. We cannot shy away from this fact. And what are the common things? That at least it is very common in India and probably all the Southeast Asian countries. And I'm sure it would be the same at some level even in Australia. You get to read all the reports and whatever comes in medical journals regarding the cases and all. That inherently the patient feels that because the information that the doctor is giving me is not matching what I've read on Google, maybe the doctor's approach is, to overburden me with extra investigations or pills that are not really required. Maybe there is an inherent economic interest which is taking precedence over my clinical well-being. So this kind of thing, when it happens, that generally does not lead to a very good outcome as far as clinical improvement goes. And because sometimes the social media information is so simplified, there is a higher risk of either your injury is exacerbated or you're not able to adhere to the doctor's advice, or you keep on doing, 20,000 different things, beating around the bush of whatever the social media is advising you. Somebody is asking you to stand on one toe, somebody is asking you to go upside down. But because it presents you a simplified way, we generally tend to gravitate towards these simpler things rather than seeking out the professional medical advice, which is not very nice. In the end, it never helps. It actually it creates a lot of trouble in you trying to achieve a very optimal clinical outcome. So this insta belief trap, yeah, this is one of the examples. The neck crack, and yes, I'm sure. Even I have witnessed quite a few of these videos on Instagram where if there is a spondylitis or if your neck is, if you have neck pain which may be radiating, so a lot of people, chiropractor maybe. I'm not saying anything against them, but the way it is being shown that a person has come with a neck injury and the chiropractor or any other person just twist the neck and crack the neck and the person is, wow, I'm great. This creates such a false illusion of the problem. I'm not saying that this is not a solution, but it is a solution which may be applicable to very few cases. But what really happens that as you grow, look, different ages will have different resilience of your arteries. The bones and joints may be stiff. They may not be same for all people of all ages. So when you twist the neck without really understanding of what's going inside, you actually many a times tends to aggravate whatever is lying inside rather than cure it. In fact, I've had many patients who have gone to some sort of a physical therapy where some stretching is done, where some bone cracking is done, and they only had a neck pain before, and now they come to me with paralysis of the entire. Why? Because the neck has been stretched in such a way in the wrong context that actually it has put more pressure on the nerves, and the patient is coming to you with paralysis. So many a times taking these advices out of clinical context is very, very dangerous, even life-threatening. So you have to understand cervical manipulation is a clinical intervention. It is not something that do it yourself type of a thing that you go home, you feed through videos and you try it. I'm telling you, it may be potentially life-threatening, or it may leave you with a permanent disability as well. And yes, if I were to explain that concept of complexity versus simplicity, so yes, the posture. Oh, I'm an IT professional. I'm having like I sit at the computer for 6 hours or 8 hours daily. I'm just having a posture issue. But we have to understand that a young age body is physiologically very different from an old age body. In a young age, you have healthy muscles, you have joints which are very healthy, they have good resilience, range of motion. The bones, they are not weak, they are not osteoporotic. But as you age, arthritis, disc issue, chronic pain, all these things do tend to creep up in your body as a part of normal wear and tear. You may not even be diseased, but normal wear and tear will still have you feeling these kind of issues inside your body. So consider a car. Your car may be very well maintained, but at the end of the day, a 10-year-old car, which is very well maintained by the way, may not be as good as a very well maintained 2 year. So you can drive and miles, millions of miles, that's okay. But a 10-year car is still a 10-year-old. And you cannot apply the same level of principles as you would apply to a 2-year-old car. Maybe the frequency of maintenance is higher. Maybe the number of times the oil needs to be replaced is still higher than a new car. But it is still not the same. So same principles cannot be applied without seeing the clinical context. So consider the scenario. You have chronic neck pain, and the internet says it's just a tech neck. You buy this brace, you take an orthopedic pillow, you buy this mattress. Whereas the reality is, in our 40s and 50s, the pain is often due to wear and tear, not just slouching of the posture. While slouching of the posture is still bad, I'm not saying that somehow I'm promoting it. I'm only saying that until and unless you understand what's going on, how will you solve the problem? The danger is that you treat a structural spine issue with a simple postural trait. You tend to do it, you tend to delay it, you tend to grow your symptoms for a period of weeks, maybe months, and maybe years. But real treatment basically is getting delayed. Whereas the reality is, if a pain is persisting for 2 or more weeks, and believe me, when I say 2 weeks, I'm still saying from my own side, let us not even be very, very, particular about what is written in the book. But if there is something which is persisting, it is not posture. Posture may be a part of it, but it is definitely not the entire picture. So never ignore these kind of things. Well, this is too technical a slide. Yeah. So, and there is another thing: how to spot a junk food advice. Instant fix. Instant fix. Real recovery requires real time, consistency. I will fix your back in seconds. It is not evidence based. They have no scientific and I'm not saying that there are not patients in which physiotherapy or chiropractic maneuvers cannot treat a patient within a matter of 10 seconds. I'm only saying that these cases are few and far between. They are not the norm, and they are definitely not backed by scientific evidence. So, what are the narratives? Conspiracy style messaging is used commonly for a marketing strategy. They don't give you a scientific argument. What they will do, they will try to create a sensation and induce a level of anxiety. 5 things that doctors are hiding from you. 20 reasons why you are spending more money on an investigation. So it creates sensationalism. It does not have a logical base, but it will create sensationalism where you will always think that whatever the doctor is telling you is somehow is preceding by economic interest rather than your clinical well-being. So this doesn't really work. And this, as usual, one size fits all solution, which is obviously there on the social media, because the very limitation of the social media is that whatever information I'm giving, that is a very static information. It cannot be contextualized or even personalized to all patients. But the presentation of it is such that it will appear as if it is a one size fitting all solution. So we must try and avoid to really gravitate towards claims where somebody says that you do this and all your problems will go away. In these kind of cases, common sense should always prevail. Common sense knowledge will always be far, far, far better than a digital knowledge that is there without context. So, what is your safety checklist? Please understand that the reason why social media is there, it is an online resource for information. Do not try to diagnose yourself. It is there for information. Information may be correct, information may be incorrect. Online content can give you some questions, but they are not a replacement for clinical evaluation. Rule 2, please monitor your symptoms and respond appropriately. Always listen to what your body is saying, because human body is such a very well made and wonderful engineering marvel. If there is an issue, believe me, your body will give you signs. Your body will more often than not tell you what's going wrong, or whether whatever you are doing to relieve relieve the body of pain, whether it is working or not. If an exercise is hurting you, you stop immediately. You should not think that, oh no, I was told that this exercise works. I mean, I saw that lady working like this. No, if an exercise is hurting you, stop. The very reason is because pain is one of the mechanisms which protects your body from doing something, right? So you have to understand if a symptom is occurring, whether it is beneficial for you or whether it is hurting you, not in the literal sense of it, but in the physiological sense. If your body wants to stop you from doing something, you must stop. If your body wants you to do something, you must do it, rather than see how many million subscribers or what is the view counter of a particular video. And yes, the last thing, where you have to verify the source of information. The source should always be verified. I am not going to comment on what is a specialist, what is the board certified specialist, who is an influencer. No, this is not the real scope of this particular the topic that I'm speaking. What I'm saying is that while it is true that certain degrees, certain specialty, certain registrations of particular medical governing bodies is a very good way to understand about who is an expert and who is not an expert. But I will always say common sense precedes and trumps everything, every time. So please prefer guidance from licensed board certified healthcare professionals over unverified social media sources. Believe me, they are never going to take any responsibility for whatever they are saying. Right? So, I mean, this is just an analogy slide that I had prepared. But very honestly, whatever I've told you about the medical science, it is not true in medical science. Actually, it is true any which ways. So I don't even know E of economics, right? So when I'll go to my investment banker, I mean the person who manages my financial advisor, believe me, I'm going to him to ask for help, right? So he may tell me that Dr. you can buy these stocks, or you may, maybe invest in gold, or maybe buy land. But it is up to me to understand what he has told me, and then, maybe read more about it as a part of due diligence. I cannot be an economic specialist or economic specialist in 2 years or 2 days. Okay. Neither it is my intention. But I must also do my due diligence before taking any advice. So when I do due diligence, it does not mean that I have to find points so that I can next time give a counter argument to my financial plan. Due diligence means that whatever I have been told, let me have a general reading of it. And if I have any doubts, ask my financial advisor rather than try to cross question his judgment. If there's something that feels off, if my gut feeling says that no, this advisor is not correct, maybe I can take a second opinion. But what doesn't work if I start unloading the knowledge that I've gained from social media on my financial advisor and give him leading questions of why he is not doing this and why he's not doing that. 20 minutes of WhatsApp reading does not make anyone an expert on a particular subject. And so, therefore, we must always take a professional advice in its own context, try to trust it. But yes, due diligence is something that we must always try to do. So, why one size fits all medical advice is very risky. You may have seen a lot of clips. Why crypto now? Crypto is increasing. And I've had quite a few of my friends who have invested quite a good amount of money in crypto. Now, look, I'm not an economics expert, but somehow I feel that putting money in crypto is bad. I mean, those who are traders, they can maybe earn money. But if something is not asset based, the backing is not by any asset. I'm not sure how long it will survive. Again, my point is not to give an advice on crypto. I am only saying that whatever is the click or the view counter on social media, believe me, that is not always the reality. And so, therefore, we must always try and avoid to look at things and try and follow them based on the algorithmic approach. Social media will always follow an algorithm. Social media never gives a contextualized solution, right? So, again, your body is at age 25, but you are looking at a problem that has been described for an age 50. So this does not work. Whatever the physiology of a body is at 50, that is definitely not the same as 25. So trying to import a solution of a 50-year-old body on a 20-year-old or vice versa even, generally is not going to give you any good results, right? So all that I'm trying to say is that medical advice is personalized. And where do you get personalized advice? You get a personalized advice only at the hands of professionals. So take advice from a professional, do a due diligence, that is okay. But don't fall into the trap of an intellectual scotoma where you are preloaded with so much of information which is not contextualized. And then you question the professional over the correct advice, right? So that is not a very good way of going about things. Now, with Surya Bhaiya's permission, there are 4 prescriptions that I'd like to share with you guys, just to again inform and tell you on a very real-time basis of what happens with the patient, what is the doctor's advice, and then now I will simply try and narrate my own experience as a doctor of what I see daily, and I find that daily the problem is not the issue or its severity. The problem is also the doctor not making a good diagnosis. The problem is it is extremely difficult for a patient to even understand and believe what the doctor is saying, despite the fact that that patient may have had trouble for a very long time. So I'll just try to cite it with some examples. All right, so let me stop the screen share right now and share a different screen.
Very informative, very provoking so far. Very nice. Thank you.
And yes, while it is true that there are certain prescriptions that I'd like to just share, however, I mean, please feel free to ask any questions or any issues that you may face. I will be very happy to answer it.
Definitely. Yeah. No. Yeah.
All right, yeah, I think the screen is visible, right? Okay.
Yeah.
Okay. So this is something that I have deliberately, I'm showing certain information. So if you can see, this is the 51-year-old male. Okay. So I'll tell you what has happened. So he basically suffers from seizure. I think in common Hindi, what we call as mirgi ka dara. He's
Yeah.
suffering from seizures, right? So, and he has been in our follow-up for, I think, around 1 year or so. All right. So what, especially this patient, what it is that I want to stress. I explained what is the patient's problem. I have also explained to him multiple times that these are the medications. And if you can see, I'm even writing the timings. And I'm telling this patient very clearly that, sir, you will have to strictly adhere to the timings because of the fact that seizures are a potentially life-threatening condition. But now let me tell you what happens. Now, if you see, I've written last seizure episode on 19/3/2025, which is approximately 1 year back, right? So I'll tell you, when on this date, when the seizure happened to this patient, I inquired whether you were taking your medication. Yes, sir. Are you sure? Yes, sir. Are you sure that you have been taking your medications exactly as I've told you? Yes, sir. So while questioning him further, what I found out was the patient does remember that out of 30 days, those 15, 20 days when he has taken medications. But the 10 days when he has not taken the medications, he does not remember it. I'm not saying that he's intentionally lying. I'm only saying that when you try to be careful about something, you will tend to remember when you have been careful rather than when you have not. So the natural response always is that no, sir, I've been taking medications. So now what will happen as a natural consequence of things? If the data is correct that the patient is taking medications, if the data is correct that the patient is taking medications on time, then obviously, as the next logical thing, as a doctor, I will order certain tests to find out what exactly is the problem. Either the issue of seizure is very severe, as previously not anticipated, or I may need to add a third tablet, or maybe increase the dose of the given tablets. I mean, that is the logical answer. But the real thing is that the patient actually missed medications, which he is not able to admit. I'm not saying he's lying. I'm only saying that if you're doing something 20 days out of 30, you will tend to remember it. But if you're not doing it for those 10 days, you will not even remember. And this is where a good doctor will also try to see the clinical context rather than immediately jump into the data which is being presented and then order tests which may be unnecessary or maybe give medications which are not required. And when I really asked his wife, okay, fine, so if you were taking medications, but how is it possible? I give you medications for 1 month. You are coming on this date. What happened in between? So, I mean, a good doctor will always try and find ways where he can catch something. And by catching, I don't mean to say that it is our job to, point fingers at the patient and somehow pin the blame on them. Our job is to find out what really went wrong, right? and whether we need to do something extra about it, or whether there is something, whether there is a change in execution which is required. All right. And then after deep interviewing, what I really found out was she told me that there was a video that the patient had seen on internet that said that if 6 months has passed after taking your medications and there is no seizure, you can probably stop your medication.
Oh my God. Very sad.
And when I when I came to know about it, I inquired. I mean, I confronted the patient and asked him, "Hey, did you do this?" So he said, "Sir, please tell me, is it not the truth? Can we not stop medications after 6 months?" Now, this is a very different technical discussion, but the truth is, yes, we may be able to stop after 6 months, but then that also is contextualized. It may not be applicable in your case, right? But the patient took the words of the video and acted in self-interest and thought that because I'm free from seizures, and as per the video, it has been now good 6 months. Do I really need to take these medications? But the doctor is giving me simply medications for his own benefit. That is where the issue lies,
Yeah.
right?
I may pause you for
So
a second. I may pause you for a second.
please, please,
If you
please,
scroll in one of the content, I
yes, please.
highly want to commend and appreciate that this is the most beautiful handwriting from a doctor I've ever seen.
Thank you.
Because
But
usually there's a
very humbly,
mindset
I must
in
submit.
doctors will write and only the doctor will be able to read. That's a mindset. But this
Well,
is
I
beautiful.
must, I must humbly admit, sir, that this is one of my worst handwritings. Actually, my handwriting is actually far better than what is there in this prescription. But having said that, it is true that many a times what we write, if we are given the same prescription the next day, believe me, many doctors won't be able to recognize what they've written. Our simple funda is if a pen has been put down on paper, it should not be lifted till the time the prescription is finished. But that is on a lighter note. But yes, but on a serious note, it is our endeavor. I mean, at least I take it personally as an endeavor that whatever advice we give, it is of value only when the patient is able to follow it. And the patient will be able to follow it only when it is legible. I mean, it is very unfair for me to expect that my patient will follow my advice if what I've written is not legible. So on this part, we all must be careful and we must be responsible for what we are doing. In fact, this is also one of the reasons why in many places, digital prescriptions are preferred so that, the issue of handwriting and everything simply, you might pass it. Anyways, so yeah, so now let's go to this second patient. She's a 41-year-old female, although let me tell you, this is what is there on record. But she would be close to 50, by the way. I'll tell you what is the important thing. Just look at the number of complaints that I've written. Idiopathic scoliosis, insomnia, backache, dizziness, headache. Just too many complaints, okay? And let me tell you the history. If you can see, this is of 11th February. So I think, yeah, it is just day before yesterday. Let me tell you, this patient came with this thick a file. This thick a file. Multiple doctors, multiple hospitals, including AIMS, by the way. Multiple doctors, multiple hospitals, multiple consultations, and she's still not satisfied. And I'm not blaming her. She's not satisfied because obviously she's feeling a certain issue, right? So I asked her and I asked her husband. She told me, "Sir, my problem is I have scoliosis." So I asked him, "Ma'am, please can you tell me, scoliosis is an issue that your spine is bending. Tell me what is the problem you're having." "Sir, I have scoliosis." I said, "Ma'am, I understand you have scoliosis, but what is the problem that it's giving you?" And believe me, she was not able to say. I'm not here to, discuss about how, let's say, less informative patients are. I'm only trying to tell, and the point that I'm trying to illustrate is that it has been fed inside her mind that she has scoliosis. And it is true. But the truth is, she is not having any issues because of it. But because there is a certain finding on an X ray or a CT scan, she is running here and there to solve this scoliosis. Whereas her issue is scoliosis, not scoliosis at all. Her issue is her husband is posted in army, she lives alone, and she is missing the companionship of her husband and attention. So her problem of insomnia, backache, anxiety, dizziness, headache, this is her problem, not the scoliosis. She has no trouble in walking. She actually actively works in the field. She's a homemaker, does everything, but her mind is focused on scoliosis because that's what doctors have told her right from the beginning of that file. So when I saw this patient, now as a doctor, believe me, as a doctor, it is not my intention to simply dismiss patient symptoms and say they are psychological. I have to analyze whether the symptoms are of physical nature, whether the symptoms are of psychological nature, or whether there is a combination of both with some level of contribution. That cannot be ascertained, but at least a combination of both, right? So I did ask her for certain investigations to really find out the cause of scoliosis. And actually, if you see, I've given her nothing but an anti-anxiety medication. And in 3 days, she's doing perfectly fine. Her scoliosis, be damned, it's there. She's not having any trouble. Because her mind is focused on the scoliosis, she has read on internet, and then her husband told me, sir, ये रात को ना मोबाइल पे देखती रहती है कि scoliosis क्या होता है. And there is such a fear in her mind that this scoliosis is making me paralyzed. Whereas she is not even understanding that she has traveled from Rajasthan to Delhi, is coming in a metro, and then walking and coming to my room at Primus. If she was suffering from any paralysis or weakness, would she be able to do it? No. But this is what she's saying. So this is what an out of context information does to your brain. And in this case, I'm not saying that every time the social media is responsible. Many a times uh, in our own lens of super speciality, we tend to focus on such microscopic things that we tend to miss the woods for the trees. Yes, scoliosis is there, but does it really require treatment? And is it really giving her the problem, or the problem is somewhere else? So you solve the problem, the patient becomes better. So one of the principles that all good doctors follow, you don't treat an investigation, you treat a patient. You don't treat a report, you treat a patient. And that is the reason why when I said about that, yes, any information or diagnosis or anything should be contextualized. This is what contextualization means, that you have to understand what's going on with the patient rather than just report on data. And believe me, all algorithms, all AI are as good as the data which is being fed to them. And because when you feed any data, you are not able to give context. So therefore, their role, although increasing, it's become very, very good. But they will always be a tool for you to diagnose something rather than replace your own experience on that. Right. So this was one very interesting case that I thought I should share. Yes, finally, one case of operative as well. Yeah, so this patient came with severe backache, there's no doubt about it. And this patient requires operation as early as possible. But there's a general tendency amongst us, which is not unfounded, by the way. We all are afraid of any surgery. More so when the surgery pertains to brain and spine. I mean, it's a near-death experience. We would not even like to think about it. All right. But herein lies the rub. While this patient requires surgery, and I'm not here to justify my clinical stand, I'm only saying that the resistance I faced from the patient side in taking my advice. The patient told me, sir, but मुझे तो किसी ने ये बताया है कि खाली दवाई से और एक्सरसाइज से ठीक हो जाता है. तो सर क्या ऑपरेशन करना जरूरी है? तो सर क्या तो look, now these questions are, I'm not saying that they are not important. Anyone in their right mind would still ask this, that if there is a better and safer alternative option available for surgery. But as I delved deeper into the matter, he showed me 3 videos on Insta where such cases have been treated by a chiropractor by giving just a crack at the lumbar area. Well, I mean, naturally, I felt, I mean, what the hell is going on in this world? But again, the important part is that you have to look at every case dispassionately and as objectively as possible. You don't give in to the patient's demands. You also don't try to bulldoze the patient with your own advice. So I told them very clearly, look, sir, the life and the treatment shown on WhatsApp and Insta, this is not life. You are the one who's suffering from a problem. You are the one who's coming to the doctor's advice. So I can only give you an advice in good faith. And I personally believe that this is the right way to go. However, if you really feel that there is another way. You can try for physiotherapy, but that is not my recommendation. Because any advice, even if it is correct, if I were to tell, the patient feels it as if the doctor is bulldozing me. He's overwhelming me with everything, right? So that is a real resistance that I also see, especially because I'm a neurosurgeon, so I see surgical cases a lot. But what I want to say is that even in this case, I told him that while you are worried about the side effects, the real question that you should ask is not what are the side effects of surgery. You should ask what will happen if I don't get the surgery done. You yourself are saying that you're not able to join work. Your field work is limited. You have to take frequent leaves from your workplace. You're saying that your foot is remaining continuously numb. You are not able to walk fast. And you are still thinking about the surgical side effects. You're already having side effects of not having the surgery. And it's only going to increase with time. So the point I'm trying to mention over here is the kind of questions that you ask or the kind of answers that you give as a professional, that exchange of information, that conversation is not possible on social media. Because again, social media gives you either a very simple advice or it gives you such a complex advice that is meant more to catch eyeballs and virality rather than a clear context. And that is where I always say that taking information is not bad, but taking information in the right context is what is going to be beneficial. So it would have been far better if that patient would probably, and I hope he does. I mean, I think that this is not too old a prescription, just 3 days before. I just hope that the patient would use the social media to understand what is the minimally invasive spinal decompression, rather than trying to question if it is required or not. Right? So, when I was preparing for today's talk, I thought, I mean, why to think of big things and going this theory and those PPTs and all? Let me just take out my prescription for the past few days and present them because those are the real problems faced by real people and in real time. So this is what we face. You should see this is she's just a 31-year-old female and she works at DRDO, by the way. Now, while I have written here low backache recurrent, let me tell you a brief history about it. She came to me somewhere around 8 months back. She wasn't continuing. Our particular visit in February, this is like, yeah, 9th of February. So she had last visited me around 8 months back. And at that point of time, I told this young girl very, very clearly, dear, your problems are not what you are thinking. Your problems are more psychological, more inorganic in nature rather than organic. And this lady has been traveling from pillar to post, all doctors wasting valuable time in getting tests done, everything, because she thinks she has a backache. Whereas her problem is not backache at all. There are other issues in a family. But I tried, I think I told you that she works as DRDO. So again, a person more of a scientific nature, a person more aligned to scientific nature of inquiry. So I tried to explain this to her. That, look, don't go by what I'm saying. You have been going to multiple doctors. Yes, sir. You have had all your tests done before also. Yes, sir. Did you find any abnormality in those tests? Did the doctor tell you there is any issue? No, sir. Every test was normal. But why am I having pain? So I told her that you have to understand this. All those doctors that you have been to, they are very good. They are experts in their own field. And if after extensive investigation and everything, you are still not relieved, so now there are only two options. Either if I do the same thing as them, then the result will be the same. So either your pathology is so big that everyone is missing it, or a more likely diagnosis says that everyone is looking in the wrong direction. Why? Because when you are saying you are having backache, everyone is trusting you for your word and looking for causes of backache. Means all physical causes of symptoms. Whereas whatever your investigations are, I'm not saying they are normal. I'm only saying that they don't explain whatever you are saying. So a correct way for any doctor, any investigator, any CBI, any police, anyone is still this. But you must always match what the patient is saying, what is your own interpretation, what is the objective evidence, and what is the interpretation of it. That means the circumstances. If these things match, that probably is a correct diagnosis. And you must always have your radars on if these are not matching. So why would a 31-year-old lady take leave from work, come to a hospital and get unnecessary tests? Who likes visiting a hospital? Nobody. A hospital is the least likable place for anyone to visit, just out of fun. Definitely not. But you are visiting a young lady who would much rather be very happy doing her work or maybe chatting out with her friends. But if she is here, that means the truth is she's troubled. She's not lying. But what is being portrayed as the right picture is probably not the truth. The truth lies somewhere else. And these are the kind of patients where it is so difficult for us to make them believe that the problems may not be physical. So we face an inherent resistance in people accepting our diagnosis. So, you have to be gentle somehow this way, somehow that way, maybe joke around a bit, but you have to make a patient understand. So, all that I'm trying to say is the purpose of me showing these four prescriptions was that any information, if it is not presented in the correct clinical context, will always be more harmful than beneficial. In fact, you look at this way. People say that books are a person's best friend. Yes, it is true. Yes, books are very important. But then what is the difference between books and a teacher? If books are so good, if books have all the information, and probably the teacher is also teaching you from the book, then what is the difference between a book and a teacher? The only difference between a book and a teacher is in a book, the information is correct, but it is static. It is set in one tone. The context is not there, but it is the teacher who will present that information always in different contexts and tell you the real meaning and application of it. So, more or less, the same thing applies in this case also. A good professional, he may not know the data of the tip of his fingers, right? Which the AI probably can, spew it out within a second. But the context, the experience, the gut, this is what really makes a well constructed diagnosis because the available data, the patient's complaint, and the clinical circumstances. When they gel well together, generally that decision is correct. And it is not just in medical science, it is true probably in all the fields. So, this is what I wanted to present. I hope I haven't bored people, but I wanted to present this because healthcare is such a common issue, and more or less each one of us, if not in our families, have faced these issues at some point of time in our lives. And what I wanted to say was that understanding the correct context generally will lead to better clinical outcomes. And so, therefore, context, as I've said multiple times, is very important. So, I rest here and I welcome all questions, if any, and I'll be very happy to answer them.
Thank you so much, Dr. Pranjal. I think you said the context very right in the beginning, that if these social media content to lose weight would have been so accurate, then the whole world would have been fit and fine, but which is not the case. And ironically, what we see common these days in the youth is that a lot of exercise driven injuries basically, and as when he said if certain exercise is creating pain, we should stop. But people, because blindly believe what they see, they do odd exercise themselves and end up into more injury, and rather than taking a proper medical advice, giving the right context, people try to fix the symptom without giving the right context, or self diagnosis or self treatment. So you have hit the nail very right, and you have triggered a lot of thought process. You have set the tone very accurate for the audience that we should take the right context, right history, and right symptoms to the doctor rather than self-diagnosis to the doctor. Let doctor do their job and do the right analysis, diagnosis for you, and give the right appropriate advice. And I think because of watching a lot of social media, anxiety and mistrust has built, and a lot of misinformation going in India as well, for example, about the negativity around how hospitals run, sometimes many private hospitals run, and all unnecessary diagnosis and all. But that said, that is not an excuse for people to do self-diagnosis and stop taking medication when doctor is saying you have to take it for this much period. And even if you stop, if you take some advice from social media, you should still consult with the doctor to validate those facts. They just take it as the information. You said it very well that we should just take that social media just for the information rather than advice, I believe. Very thoughtful, impressive presentation, Dr. Pranjal, and maybe give us a brief background where this thought came to your mind. Why do you think? Where did you come? Why this thought came to your mind that you should present this uh, session or presentation today? I want to go a deep, layer deep into this core symptom. Why? What was the problem in the society?
Look, the reason why I tried to present this was, look, this is just a use case for me, as far as I'm concerned. This is just a use case scenario. Use case scenario means I'm talking about issues that we have faced in the medical profession or healthcare profession. But the underlying principle is deeper. The underlying principle is still this: because we don't understand the context, we generally tend to misunderstand the situations in our life. It may be pertaining to our professional lives, whatever profession they may be. It may be pertaining to our social life. It may be pertaining to our family life. But the truth is still this: when we see any information out of context, generally we tend to have a very divergent view about it. And that information usually hurts. I chose this particular topic as far as healthcare is concerned because of two reasons. Number one, with God's blessing, look, doctors are still considered to be a very respectable profession everywhere, not just in India, right? And so, therefore, when issues of trust and mistrust creep in this profession, it is something very serious, and we must really think about it. I, as a doctor, cannot simply say that all patients are wrong because they are doing nonsense by watching social media. While it may be true to a certain extent, but the truth is still this: rather than focusing on what patients should always do, I should always try and pitch in of what I can do as a doctor to solve the problem. If a patient is having an issue in understanding something, it is true that as a neurosurgeon, I'm very busy. I don't have time to give emotional support to the patient, explain everything from A to Z. But that does not mean that I cannot do anything at all in a broader context. I started this entire thing about social media. I thought I shall also make certain videos where I have time for 15 minutes or 20 minutes or an hour. I can explain certain issues, very common issues that I see daily, or very common issues that patients ask me. Take subjects rather not from the what the social media tells me has the best views, but what I find daily. And if I'm able to explain this by terms of a video or a podcast, maybe a lot of patients will benefit, especially my patients and maybe other patients also, right? So while I thought that I should address this in this fashion, I realized that this is a problem which is not endemic to just medical profession. It is a problem that we see day in and day out in almost all aspects of our life. So the example that I gave you about the difference between a book and a teacher, believe me, I haven't read it anywhere. But so the same book is there with my residents. But if I explain something to them with the same book, the meaning becomes different. So we have to understand that life is such a complex thing that it cannot be fit into one compartment. There are no rules. The only true rule is understanding the context. And while you asked, sir, how did I really come about this topic? So for that, I will thank two of my friends. They are my childhood friends. They are not from medical line. One is from engineering line, and the other one started off as an engineer, then became a lawyer, and now he's a professor. He has been traveling all these places. But the important part is that at one point of time, I remember it has been quite some years, but he asked me one simple question: Pranjal, what do you think? The ends are important or the means? And so over few drinks, we all they are very, not me, but they are very intelligent people. So everyone give their answer, but when they ask me what do I think is important, the ends or the means, I told them clearly that neither is important. The only thing which is important is the context. In the given context, the ends are important. In a separate context, the means are important. So if we are able to define the context, if we are able to really define the problem, it is only then we can apply the solution. And generally, people tend to spend a lot of time finding solutions. Whereas the real time needs to be spent in great definition of the problem. Because once you define the problem, believe me, solutions are simpler. So when I had this concept in mind, so that's what when I thought that if I'm being given a platform on HR, let me try and address this from the point of view of a medical professional, bring the idea of context into picture, and then maybe as opportunity would be there, then discuss about not very technical issues of neurosurgery and this and that, but what is it that in general we should do regarding our own health, how we are prejudiced by the information, our education that has been given to us about certain treatment systems are good or certain treatment systems are bad. I mean, all of those information, I think, personally, believe is in very black and white. We are not able to appreciate the nuances of the gray. And that is the reason why we face a lot of problems, especially healthcare related and other problems also in our life. Right. So somehow we feel traditional system of medicine is, oh my God, it is so old age. It is so mumbo jumbo. It has got no evidence. We have been trained to think like a scientist. But actually, we are not thinking in the terms of science. We are the people who are so prejudiced that we believe that our science is the only science, right? So when I thought about that, I thought that maybe it is important as a learning experience for me also, that me being a neurosurgeon trained in allopathy and doing everything doesn't mean that I know everything. So it is important for me also, just like I'm trying to tell people, it is important for me also to not become one of those six blind men trying to feel up the elephant and describing it. Try and be the sixth, seventh one.
That's
Try and
very
be a seventh one. And
very good example. Yeah. I'm very conscious of the time we have been so lucky to hear from you directly while you're from your very busy schedule. Hence, we are doing this pre-recorded session because the time I run webinar is may not be always suitable to you, and I'm aligning with your availability. So highly appreciate your time, highly appreciate your thoughts, highly appreciate the initiative you want to run, and I want to be supportive and I want to connect more often with you and discuss more wider issues and maybe series of these thoughts if we can carry forward. We can work together to take the message to the wider community. So thank you so much, Dr. Pranjal, for
I
your
really
time
appreciate
and
that.
thoughts today. And we'll meet again and talk more about various issues. With that
You're
thought,
always welcome, sir. And thank you.
I'll request all the audience, those who are watching out on YouTube, please like, subscribe, and share. And also reach out to me for any such thoughtful webinars or podcast sessions you want to do with me uh, by connecting with me through social media. What an irony, we are talking about social media and producing content for social media. But that's the right thing. And what you said is that the social media is for information, not for creating what's the other thing you said other than information? It's not for you're in mute, Shruti.
What I mean to say is, it is a,
No, Dr. Pranjali,
yeah, am I audible?
yeah,
I think so.
yeah, you are.
Yeah, right. Yeah. So as you said, believe me, even I took the help of AI in trying to organize a PowerPoint and trying to channelize and align my thoughts. But again, what I'll tell you is this, that when you let tools, elevate to a place of the person who's controlling those tools, that is where the issue is. So it's like alcohol may be a recreational or maybe more of a cultural thing, right? But when you let alcohol take control over you, that is when the trouble starts. The same gun is used by a soldier or maybe a gangster. So is it the problem of the gun or the person who's holding it? So exactly in the same way, this AI or social media, it is a great tool. If you let it control yourself, you will have all your anxiety and nonsense running through your mind. But if you control it, it is a great enabler for you to do your work and for you to reach out to your audiences or do any n number of things. So it is better to control things rather than be controlled by it. That's what I wanted to say.
Thank you so much for those closing comments. I really appreciate your time again. Thank you so much. Thank you, Shruti, for joining and connecting. And have a good day and good evening. Namaste.
Good day.
All right.
Namaste.
Take care.